Okay, so could you please start by just introducing yourself, your name, your membership status of the college, and where you practice?
Yeah, my name is Catherine Labinjo. I'm a fellow of the college and I'm also a council member. I represent the constituency of Central and Tayside. And I've forgotten already what else you asked me to say.
Your medical specialty.
Oh yeah, sorry. How could I forget? I'm a cardiologist and I work in NHS Forth Valley.
Thank you very much. So I'm going to start off by asking questions which relate to how coronavirus has impacted on your professional role. Could you describe how the coronavirus pandemic has affected your working hours and practices?
In terms of my working hours, I would not say they're particularly longer, but the way that I practice is quite different. And this interview is an example of that. So I have a headset and I'm looking at you on video, and that's not something I did very routinely until March of this year. Um, in terms of affecting how I interact with patients, the same is true. And my patient contact has diminished considerably, and I'm now dealing much more with patients on the telephone and occasionally using video conferencing. How I deliver my work and where I deliver it's also changed. There's competition for space at work to be able to make these kinds of calls and interactions. So I'm sometimes find myself just finding any space anywhere. So I might not necessarily be in a consulting room that I'm familiar with or in my own office. I might have to, book a room elsewhere or find a corner of another place. And I have for the first time been doing much more work from my own home, including clinical work, contacting patients and having consultations with patients from home. So that's really different.
Have you experienced any shortages of medicines or medical equipment in your work, or do you have any comments on shortages you've heard about more generally?
In my own area, shortages have been managed extremely well. So we feel that we've been very well provisioned, for example, with things like PPE, and where there have been issues about supplies, these have been managed very well, and we've had advance warning of things changing. So, for example, one example of that would be I was fitted for a special mask, the mask to protect us from COVID. And it became apparent that the supplies of that mask were diminishing, but that was clear in advance. So I had to go and be refitted for the new mask. And I think there was quite a lot of thoughtfulness around, advanced planning and the kind of supply chain, if you like, for things here. So we haven't had very much in the way of shortages at all.
Without naming or giving identifying information about individuals, are you aware of any particular patients' experiences which you could share with us, which illustrate some of the complexities of treating people under coronavirus and lockdown?
Gosh, that's interesting. Um, yes, so I think in the early stages, particularly when we were in what we would call maybe the tightest, most intense part of lockdown, not only was there a systematic change to how people received care, so they didn't go, for example, to their GP or they didn't have face-to-face consultations, but there was also a massive fear factor about how to receive care. So there were things that weren't available to patients, but there was also their reluctance to not avail themselves of the things that were available, the fear, for example, of meeting other people and coming to hospital. That led us to do things differently. And one of the things that was really interesting about this era is that we were given permission to do things differently, and we didn't ask so many questions around whether we were allowed to do things. I mean, we were still safe, but a good example might be a patient who was at home complaining of breathlessness, someone with multiple comorbidities who was older and perhaps what might be considered in a higher risk group. Because of COVID, there was a fear of those patients coming, for example, to have a COVID test, even though they had a symptom of breathlessness. So a team was enhanced within Forth Valley where those patients could be assessed by a general practitioner or a care of the elderly physician within their own homes. Because I'm a cardiologist, I sometimes see people who are breathless not because of COVID, but because of heart failure. And it became apparent that that team who were going out to assess older, more vulnerable people with potential symptoms of COVID actually were finding patients at home sitting with heart failure, too fearful to access the normal channels. That could have been a disaster, but in fact we learned a lot from that, and some patients' experiences were really enhanced in that they got a quick assessment in their own home. They were able to have treatment in their own home. The physician who was looking after them in their home was able to contact me for advice, and we set up a Teams group where we could do very quick, rapid turnaround, what you might call case discussions or MDTs. And I could give advice on treatment, and where it became clear that that patient was more precarious at home, perhaps might require to come into hospital, again, we were trying to avoid that. We quickly set up an ability where we could give them some of the treatments that they required in hospital, for example, intravenous diuretics, but on an outpatient basis. So they came up, had the diuretic, and went back to stay in their own home. So I know lots of the descriptions of care in this time are descriptions of care that's been less good, but that for me was an example of care that paradoxically was better, more person-centered, and was able to be delivered in a way either in the patient's home or in an ambulatory way where they could come in and out of their home. So that was a positive experience to start with. I think on the other hand, in general, we noticed fewer patients coming to hospital with complaints, for example, of chest pain, and we wondered where those patients have gone. And then more specifically, we recognized that there was, I would say, across the piece, quite a loss for patients in a number of areas. So many people felt that they lost the face-to-face contact that they would have had with a caregiver, particularly a nurse practitioner or a doctor. I recognised when I was telephoning people that that might have been the only contact that they'd had with anyone that week. And they were keen to stay on the phone and chat and really to ask questions, not so much about their healthcare, which was really diminished, but a lot of questions about the current state of affairs and about coronavirus and how to stay safe. So that kind of encompasses the range of experience to some extent. Other patients we know who were expecting treatments, things like bypass surgery or valve replacement surgery, they certainly had a hiatus in their treatment. But I would have to say that both the major centres that we deal with worked really hard to make sure that we quickly triage people around clinical need, and those people who needed to go ahead and have their cardiac surgery still had it.
Thank you. So we're starting to hear more about the long-term effects of coronavirus on individuals. Do you have any thoughts on that, either specifically in the context of cardiology or what the long-term health effects might be more generally?
Well, that's making me smile because I'm thinking about people looking at this interview in the future as I sit here on the 5th of October 2020 and say, really, I've no idea. I mean, I don't know if anyone has any idea what the long-term effects of this virus will be. And on the one hand, we're receiving a lot of reassurances about how, for the most part, people who are young and fit can have this virus and shake it off. We're being, to some extent, asked to categorize it a bit like the common cold. And on the other hand, we see that people are affected by it, can be devastating in some people, and we're definitely hearing that it's much longer to recover from than a common cold, and there is this emergence of longer term effects. The context of that's really difficult because these are people who've been ill during a pandemic and experienced isolation and perhaps lots of other social pressures, financial pressures, family pressures, and we know that that in and of itself can cause long-term consequences for people and their well-being. So how we're going to tease apart, if we really even should be trying to tease apart the more physical from the more mental or psychological effects of being affected by this condition, I don't know. It seems likely because of the unique way that it affects some of the systems a bit more pronounced around clotting, some more cardiovascular effects. It seems likely that it's possible that there'll be long-term effects in some people. What we're hearing at the moment appears to be syndromes that are much more like the long-term effects of virus or viral type illness in general, rather than very organ-specific things. I think we'll just need to watch this space.
And a similar question in terms of the long-term effects on the NHS and the provision of care. Do you think that coronavirus will fundamentally change how things are funded, how things are structured in any way?
I don't think my working life will ever be the same again. And I remember saying quite confidently, like a great forecaster, when people were talking about how the next 4 to 6 weeks were going to pan out when we started having these conversations in the middle of March. I felt quite sage and wise saying, well, do you know what? I think we might be needing to think about something for 6 months. And there were gasps around the room. And it turns out I don't think I was so clever at all, because 6 months is a pretty conservative estimate for how long this is going to impact on us. It feels like there'll be a permanent change because there's no one untouched by this, and the kind of social and economic effects are so great, and the impact of those things on people's lives and well-being and futures is going to be very great. And as a health and well-being organization, we're going to need to respond to that anyway. In terms of how we practice, I hope that there'll be many good things that come out of it. People were, for the most part, collaborative in their approach. Lots of the barriers for working across different systems came down. They took quite a pragmatic approach. And a lot of the time, I think people were very person-centered. People were happy to say to patients, what do you need from us right now? We may not be able to provide it all. And I hope that there's a long legacy of that. Some of the walls are beginning to come up again, the silos between, oh, we don't do that, or we do, et cetera, et cetera. So that might be not a permanent effect. But I'm hoping that some of the good stuff, especially around innovation and change, will be maintained. I think how we interact with each other as humans within the health system will be different. Our view of infectious diseases, how willing we are to touch hands, whether, hold hands, how we occupy the same space with or without masks. I think the legacy of that will be really long, and that's sad, that part of it. I think I will do so many more telephone consultations than I did before. And, it's kind of shaming realizing the people we dragged up that we didn't need to, and how easy it is just to be stuck in an old-fashioned system. And, there'll be good things about that changing. Whether there'll be the blanket acceptance of video calling and video consultations, I don't know. There was a little bit of appetite for it amongst the cardiology patients at the beginning. Now many more of them are saying they would prefer just to have a telephone call. They can't be bothered with the video part of it. So we'll see. I'm not sure about that. And in terms of funding, I think, yes, in Scotland certainly we're feeling that there's a real impetus to change the way that unscheduled care takes place. And a deadline, in fact, for the end of this month for boards to look at how they're going to provision care for people in an unplanned way, really differently and radically, and much more based within communities and so on. I'm sure that's going to have long-term funding implications too.
Do you have any comments on how the government has responded to the pandemic, either the UK government or the Scottish government?
Gosh, yeah. Well, from the perspective, let's look at the Scottish government first. Healthcare, as you know, has devolved to the Scottish government, and I felt well informed and well looked after. And I felt that broadly there was a team of sensible people trying to do the right thing in a difficult situation, mostly driven by fact and information and data, and some difficult decisions to be made. And I thought the messaging was quite clear, particularly at the beginning, for us and for patients. in a time that was moving quite quickly. I didn't get the same sense of that from the UK government, and I felt that the leadership, perhaps UK based, could have been better, and I'm not sure on what basis some of the decisions were made. And I think I have less confidence and more cynicism in what happened Westminster based. That said, in an extremely difficult time, and with these tensions of healthcare and the economy pulling each other apart down the middle. But yes, I think the messaging and leadership for me was clearer in Scotland, and I felt less confident about that in England. And some of the things we saw and the behaviours we saw from our leaders were extremely disappointing. And that occurred both in Scotland and the wider UK.
Thank you. So you've touched on this a little bit already, but I wondered if you had anything more to say around how the public have responded to the pandemic, you know, whether following regulations or the responses you're getting from your patients around complying with regulations and social distancing and so on.
I've been completely gobsmacked about how absolutely terrifically amazing the general public have been. I think to try and communicate these concepts of public health to the general public when we have taken public health for granted for so long. You know, we don't worry about how clean our water is. We don't worry that much about immunization and so on. The things that keep us safe as big communities from a public health basis just go unnoticed. I don't think anybody would have said that, you know, the general public don't go around saying that the public health measures are the most important thing about healthcare. You know, they talk about access to GPs and other services. So that was a really difficult thing to communicate quickly, that this is not a kind of personal condition. This is a community condition, and community has to behave really differently. I think people took that on board really brilliantly for the most part. Of course, there are people who didn't, so they're the headlines. Most people very thoughtful, very caring about the impact on medical staff. Almost every call I had in the first few months wanted to make make a special mention of how caring they were about what we were having to do in hospital, and how thoughtful and thankful they were about that. So I think people have responded very well. Understandably, as it gets personally tougher, it gets harder for people to respond as well as they might. And as it gets more confusing and the messaging gets more difficult and it goes on for longer, that's difficult. I suspect for some young people it was particularly hard. And you know, I'm a mum of a couple of youngsters who I think have done pretty well, but it was a pretty tough time for them. And I think, you know, they get a little bit of a hard time, but it's probably something that wasn't going to affect them personally. And, you know, for young people to think very about the communities more widely and not in a very personal way, after all, we've all been there and done that, I think was tricky. But for the most part, people I think have been extraordinary.
Thank you. So the next questions I'm going to ask are more personal than professional.
Okay.
Just a reminder that if there's anything that you don't want to answer, you're absolutely welcome to just say, no, I'd rather not answer.
Okay.
But don't feel pressured in any way.
Okay.
So have you had, or do you know of any colleagues, friends, or family members, without naming anybody, who has a personal experience of contracting coronavirus? And if you're comfortable with it, could you describe that experience?
Well, I'm pleased to say that no immediate family members have been affected, and I feel blessed for that. I've had friends who've been affected, colleagues who work in healthcare, and many of them experiencing an illness that was much worse, I think, than they'd expected. They're similar ages to me, though. They're middle age, and perhaps in the group where it's not so easy to shrug it off. And I think there was a lot of fear for them and concern, and continues to be concern about the future, but they have recovered. I also have a goddaughter who has recently started at university. She's a fresher. I spoke to her this week, and we chatted for a little while, and she said, "Oh yeah, and by the way, I've got COVID." I said, "Oh, okay." She said, "Yeah, but I'm okay. I mean, I wasn't quite sure if I was just tired. I mean, I had had a few drinks, you know. I mean, we've got a few hangovers, which made me smile a little bit. I wasn't sure that people were going to be partying and having hangovers in Freshers Week, but they are. Silly me, of course they are." And she said, "But everyone's got it. I don't know anyone who doesn't have it here." So that's the kind of other side of it, really. And she's not too concerned. Her mum is very anxious about it. She's not too concerned. And I have a friend whose frail and elderly father who lived in a nursing home, who suffered with dementia, caught COVID and died. And that was interesting because, of course, it's desperately sad. And yet, from my friend's point of view, she felt that he had a very poor and low quality of life, and it wasn't surprising that he would be vulnerable to almost anything going, particularly this. And she didn't feel particularly aggrieved that he had been susceptible to this or succumbed to this condition, recognizing that he was probably within the last 6 to 12 months of his life anyway, and his quality of life was not good. So that's really the range of experience of people that I know in my personal life who've been affected.
Could you describe how your home life routines have been affected by lockdown and COVID?
Wow. Well, as soon as you say that, I just have an image of my husband and I. We both work in healthcare, standing at the back door to our house in our underwear, because we did that a lot at the beginning. And we had a very elaborate routine to allow us to come home, because both our children came home too. So yeah, so that would be one thing. You know, clothes off at the back door, straight into the washing machine, the clothes. Wiping down keys and bags, washing my bag, straight into the shower, not speaking to anyone. You know, this very elaborate kind of disinfection routine. I don't do that now, although I do still wash my hands and I'm careful. You know, stories of people saying that you would bring COVID back home if you wore the same shoes. I bought new shoes. I bought scrubs, my own scrubs, because the demand was high, and that was quite nice because I could buy scrubs that actually fitted me rather than a lifetime of scrubs that are designed for men and don't fit me. There's my characteristic dig. Unisex, it just means men, obviously. Anyway, I digress. So there was that aspect of it, rituals around that. But some other things that changed. So 2 children at home, one studying online for university and one working, and they did very well and just got on with that. But a different pressure, you know, more food and shopping and cooking and more people to look after, so a little bit of extra social pressure there. The weather was quite nice, and I took the opportunity. My husband and I sometimes do lift sharing, and he often cycles. I cycled home much more than I had ever previously, and started to do my commute differently. I use a bike and train services continue to run, although reduced, and were beautifully quiet and great for people who wanted to use bicycles. So that was good. I didn't get to see my dad. He was in a shielding group, so I would walk round to his, because we walked everywhere. We walked so much in lockdown, didn't we? It was nothing to walk for 45 minutes or an hour to visit someone. And stand in the street and chat to him out of a window. So that was different, but actually in some ways quite nice, you know, doing things a little bit differently. Yeah, so that might be the biggest impact, and very significantly affected by the restriction on travel. So I've got a dog, I like to walk, and I like to decompress from my work by walking somewhere where I don't see anyone else. So not being able to go to hills and mountains was really tough in terms of coping with the way that I would normally de-stress from work.
So given what you've just said about your personal experiences and also your work experiences, do you feel like mental health and stress-related support for medical professionals is significant? Is there more of that needed as a result of the impact of COVID? Do you get the support that you feel that you need, essentially?
I did feel a bit unsupported, but it's difficult to know in that situation and even in other situations how to provide the best kind of support. We're lucky here. There was very quickly set up a sort of web-based support network, which was good. There's peer support here in Forth Valley for consultants. There's obviously that informal support that one has in the usual network at home. I think what I recognized that I found particularly difficult was just the lack of being able to have informal conversations with people, go out for coffee, do just small things which help to contribute. And I found the fact that many of the other people who you might be leaning on had their own pressures as well. So I was kind of perhaps reluctant to seek out support, which might have been useful. But I do think culturally what we need to strive for is as an acceptance that recognizing your limits, recognizing your own stresses, valuing yourself sufficiently to take breaks and time out and do all of those things is good and healthy and normal, and that one of the risks at the beginning of the kind of all hands on deck mentality. I mean, I was volunteering to help to do everything and everywhere, and you just wanted to do stuff and make a difference. One of the risks of that is that you just feel a bit trashed by it, 3 or 4 months later. I was a bit guilty of that. Not that I was at the coalface or working for hours and hours on end, but just maybe not giving yourself enough gaps. And I think the other thing, I don't know if you're going to go on to mention it, I found myself really obsessing over the data. I mean, I've got about 7 or 8 different apps on my phone, looking things up, and every day I feel I had to track everything and know what was going on in the world. And I think just the uncertainty of this condition and wanting to control it by understanding the data and so on. And eventually I had to get rid of all of that stuff because the information overload was really stressful. The social media thing was really stressful, and I had to kind of distance myself from that as part of looking after my own mental health.
Thank you. You've kind of almost already answered my next
stolen your question.
No, it's fine, but I will ask it anyway in case there's anything else.
Yeah.
So my question was, where do you look for accurate information on the pandemic, and do you have any thoughts on the role of social media and the internet in forms of disseminating information? So essentially what you've already said, but if there's anything else.
Yeah, well, I thought the information available was pretty terrific. There was almost like competitive medic stuff as usual. Who's got access to the latest data and knows the most? And we're all, are you in the Stanford group or are you in this? I read the New York Times coronavirus update. I read the Financial Times, neither of which are papers that I read normally for the COVID updates. I did that through their apps. I used the Scottish Government app, the UK app, Health Protection Scotland. I could probably still open half of them in there actually. Less of Facebook. I don't use Instagram, but I did get some information from Twitter, and I often do get some information from that. So on the whole, it was helpful to be able to access those things, but I think I just needed to manage it a bit better, to be honest.
So this is my final question for you. So you're nearly free. So you are part of the college's Equality, Diversity and Inclusivity group, and I wondered if the coronavirus pandemic has sparked any particular discussions in that group, or any aspects of your work that you think are impacted by coronavirus in the context of that area.
Yes. Well, one of the things that's been impacted by the college is that group's ability to meet. So that's one of the difficulties. Um, in terms of those issues more broadly, I would say maybe two things. First of all, the Black Lives Matter issues came to the fore during one of the more intense parts of lockdown. And I found that really impactful for me. I don't know if that was because I'm a person of color, or whether I, I suppose it just landed at a certain time. But that was really, my children were at home. We had good discussions around that. It seemed there was a space to be able to have more conversations around that during lockdown. I don't know if that's a coincidence or not. And we talked about what, as a family, what we might do and what contribution we would make. And we also talked about that in the college. And that was helpful and interesting, and it prompted some reading for me and thoughtfulness about wider issues of diversity. And of course, because of the way COVID affects BAME individuals, and just how important it was to recognize that and I think recognize the plight of individuals being different from diverse backgrounds was really interesting. And then more widely, I would say, as is often the case, but you recognize that people who are seeking help or getting help or whom we're connected with are not always the patients with the greatest need. And I think the inequalities related to access have really been exaggerated during this time. I'm not quite sure what we're going to do about it, but every meeting I go to, I try to talk about that. So there are the people who were harder to reach before in the hardest to reach communities, whether that be because of whatever social barrier or other barrier there might be, those all seem to be much worse during COVID. And I think that continues to be a problem and will continue to be a problem. Obviously, poverty influences access through things like phones and computers and being able to get to wherever the latest community centre is or access healthcare if it's not being provided at your GP, and all of those things just multiply up. So I don't think as an equality and diversity group within the college we've got a strategy that encompasses that yet, but that will definitely be on the agenda for the next meeting.
Thank you very much. So essentially we're done, but I just wanted to ask, is there anything that you haven't had the chance to say that you would like to share?
I made a few notes earlier, but the only thing, just a couple of words, but the only thing I think we touched on it, but I'll just mention it because I've written it down, was touch. And that thing about not touching people and how strange that is to be a healthcare provider and be discouraged or afraid or have your touch unwelcomed, which was sometimes the case, particularly in settings where people were very poorly or where either the patient themselves or their family member was very distressed. And I'm sure that they found that difficult. And I definitely found that difficult. And it really made me think a lot about what I get out of being a caregiver. And sometimes you forget that the handshake or the warm touch that you give to someone is actually just as terrific for you in a difficult situation as it is for them. So just the importance of touch. I don't know what we're going to do about that going forwards, but I'm hoping we'll get a bit more of it back. And it's still, it was fun being able to elbow bump octogenarians who embraced that. But in those really challenging situations where you just instinctively want to feel the power of touch, to not be able to do that or to be discouraged or feel awkward about it was really tough.